We're on countdown mode to the midterm elections, now 5 days away. A recent Fox News poll shows that health care is the most important issue for voters. Joining us right now is Paul Keckley. He is former executive director of Deloitte Center for Health Solutions. And Paul, it is great to see you this morning. Thanks so much for joining us.
Good to
Break
see you.
it down. What is the most important issue in terms of health care? Within health care, what are voters nervous about, and do you think this drives their vote?
Well, there were four that kind of hit the top. One is pre-existing conditions. You're hearing so much about that. 100 million people have a pre-existing condition, so things like getting your weight down and pre-diabetics and things like that, you've got to deal with things. Medicaid expansion. We have at least 6 red states that are considering various ways of expanding. The opioid crisis and what we do about that. And then insurance coverage. You know, the exchanges open today. This is the 6th year of the exchanges opening.
Right, open enrollment today, right?
Yeah, it is. So, you know, at the top of that list, what's getting a lot of attention right now is this pre-existing condition issue. Because in the Affordable Care Act, it said you can't deny coverage if you have a pre-existing condition. We have 20 state attorneys general suing to basically say, since the individual mandate is thrown out, then the whole law is no good. So therefore, there's no protection for pre-existing. So it's going to be a dicey topic. It lends itself to sound bites and not to a substantive discussion. So what do you do about a pre-existing condition? Do you go on a diet? Do you do the low carb thing, the Atkins kind of stuff? Do you?
But that's not what they're talking. I mean, the political messaging from Democrats on pre-existing conditions, one, they act like that people don't get coverage anymore, that somehow the Republicans did away with the coverage for pre-existing conditions, which at a federal level did not happen. Number one. Number two, they act like it's all about cancer. It's not. You're talking about things that are manageable for somebody. Going on a diet, losing weight, and no longer having type 2 diabetes, but again, it's the world of sound bites and hysteria.
Yeah, and there's a lot of fear mongering in healthcare. So you would not know that in many states, as they open the exchanges today, the rates are down, and the number of insurers participating in the exchanges are actually more now than they were a year ago.
Yeah, in fact, I read somewhere, I think that the rates for the coming year are supposed to be up only 5%. I have not heard a single Republican candidate make any hay out of that. And it seems to me they could, because the Democrats have basically positioned the Republicans as destroying Obamacare. Rates are going to go through the ceiling. As you say, it's all sound bites. But why aren't Republicans out there pushing back and touting some of the things they're doing, like these small group association plans, which I think sound pretty good? But you're the expert. I mean, are they
some
any
plans
good?
are going to be up 20%.
Right.
Others are going to be down. So on average, it's 5%.
But
there are some plans that are going to be up significantly.
That's right. The variability state to state is so wide.
Yeah.
And the latitude that states have to kind of jerry-rig things to make that one look a little better than this one is still wide. So that's the reason you've got such high variance. But if I said 25% of what we spend in health care is not necessary, and to get from here to there, we have to make some substantive changes to the system, that would gloss over to most people. That's just too much information. But I'd rather say, protect my insurance, let me see the doctor I want to see, let me have the insurance that I think I need. And that's kind of the way the public thinks about health care.
So I guess related to Liz's question, it seems like a lot of Republicans have decided to not talk about it.
Yeah.
If they instead they were to sell, whether it's the association plan, some of these other changes to make insurance coverage more affordable, more available, is that a compelling message if they choose to make it, or are people still afraid that some undefined change is coming?
No, it's not a compelling discussion, because association health plans have kind of come and gone since the 90s, if you remember. So immigration works better for a Republican. For a Democrat, it's about health care. It's a great dividing issue across the parties and across demographics. We know it's substantially more important to women and to urban voters, and it is less important to men. So, no, it's not something the Republicans can hang their hat on.
Okay, what about the alternative? We've talked about how most House Democrats have endorsed something they are calling Medicare for All.
Yeah.
I think you know, after that law passes, the number of people with Medicare is this.
Well, there's so much. This is a great soundbite issue. There are 8 different pieces of legislation right now in the Senate to promote Medicare for All. None of those has the same definition of Medicare for All, nor a price tag associated with it, nor what would that mean? Would it mean that the government's going to determine what's appropriate care or not, or which doctor I see, or which hospitals do things or not? So,
the one that most House Democrats have co-sponsored gets rid of the Medicare program.
Yeah, it's everything. It gets rid of
everybody, private insurance, Medicare, everything gets jammed into a new government system.
I'll give you an interesting soundbite here. That if you call it Medicare for All, instead of calling it single payer or universal coverage, it polls 3% better.
Yeah.
Because the most satisfied part of the population with their own health care are people on Medicare.
Yeah, that's interesting.
And well, they love it, and it's going broke. The hospital trust fund runs out of money, and benefits get an automatic 10% cut in less than 8 years from now, I think. So there's a $50 trillion hole in Medicare for All because it is so generous, and people are extracting more from Medicare today than they ever paid in. I'm not wrong about that, am I, Paul?
Absolutely. And if, you know, this is the show about money.
Yeah.
In the S&P Healthcare Index, since the passage of the Affordable Care Act, 63 companies in that index, up 186%.
Doesn't surprise me.
About 40 points higher than the rest of the S&P. So healthcare has done well, while the economy has kind of staggered along.
Just give us a word on the 2019 open enrollment for the Affordable Care Act. What changes to Obamacare do you think people will see? What do you want to tell people as they look at their open enrollment opportunity today?
Well, one, you've got more insurers putting products into the exchanges. Two, the enrollment period's shorter. It's 6 weeks again. It ends December 15th. It's not the 3 months that it's been. And there's less money available to the states for navigators or helping people enroll. Remember, they've cut those budgets for advertising and a lot of things. So they'll be on their own.
Wow. All right, Paul. Great to have you on the program. Thanks very much. Paul Keckley joining us there.